Hello, my name is Tyra Adams, student physical therapist with the University of St. Augustine. The first question is, what is the purpose of the Movement Summit? Describe the identity principle of the APTA. So the purpose of the Movement Summit was for a group of leaders to come together to discuss the movement system. What is the movement system? So to create a working definition of what the movement system is in the field of physical therapy, how it relates to our practice, and then also to define what the movement system is for the consumers and also for other professions or other practices who may also deal with the movement system, so that everybody knows what the movement system is and how we care for the movement system as physical therapists, so we can all be on the same page as far as a definition. In regards to promoting the advancement of the movement system, we need to be able to use that definition to be able to promote the movement system in research, in education, as well as in the practice of physical therapy. The identity principle is a guiding principle basically of the APTA's vision statements, transforming society by optimizing movement to improve the human experience. And so at the core of that vision statement of the APTA is the guiding principle, the identity principle, and at the core of that principle is the movement system. The second question, how do physical therapists fit into the movement system? Well, as physical therapists, we are movement system experts. The goal is to have students become movement system experts. And so what that means is that we have the ability to integrate the systems of the body into and how it relates to movement. And so if you have an issue with the cardiovascular system, that affects movement. If you have an issue with the respiratory system, that's going to ultimately affect movement. If you have issues with the nervous system, that affects movement. So how do all of these systems integrate to form movement? And where there's movement impairments or movement disabilities or movement dysfunctions or limitations, you can identify those impairments, limitations, dysfunctions, and ultimately work to try to correct them or to improve movement. If all physical therapists were movement system experts and the public, our colleagues, and all other stakeholders recognized us in that way, what positive changes would we see in the profession of the field of physical therapy? Number one, trust. Number two, respect as physical therapists, as movement system experts. So we'd see advancement in the field of physical therapy because of that. Because of our knowledge, because of what we know and what we do, and how we are able to diagnose and improve and optimize movement. How do you see the patient-client management model interfacing into the movement system? Well, what the patient-client management model does in regards to the movement system, it allows us to look at each system and determine its function. How is it relating to the impairment? How is it relating to the dysfunction? How is it relating to the limitation of the movement system as a whole? So we're looking at examining, we're looking at evaluating, we're looking at formulating a PT diagnosis based on what we find in our examination and evaluation. We're looking at diagnosing, which I mentioned already. What is the prognosis? And then what is our treatment going to be? Formulating intervention, effective interventions, and then looking at outcomes. How are we able to take each step? So it gives us a systematic approach, a step-by-step approach in looking at the movement systems of the body as they relate to movement, identifying dysfunctions, identifying impairments and limitations, and ultimately working to correct those. What are the essential activities that should be a part of the standard movement analysis? Number one, a visual observation. How is the patient moving when we first see them? We need to look at how a patient performs tasks. How do they perform their activities of daily living? what prevents them from performing at their activities of daily living, assessing pain, looking at the gait analysis, looking at the angular kinematics, how are the joints functioning. So we're looking at physical, we're looking at actually doing passive range of motion and active range of motions and things like that. So that all of those things play a role, essential role in the standard movement analysis. Thank you.